We understand that a lot of you are unsure of what Medicare is, even those that are approaching that magic age of 65 when you become eligible by paying into Social Security for at least 40 quarters. Certain people younger than age 65 can qualify for Medicare too, including those with amyotrophic lateral sclerosis, otherwise known as Lou Gehrig's disease, and end-stage renal disease, or those who have been disabled for 24 months or more. So to help fill in the blanks, we'll be covering the ABCs of Medicare. And while we're at it, we'll throw in the D too. You'll see what we mean. Let's start at the beginning. Medicare was passed into law in 1965, the year that Bob Dylan went electric, and a gallon of gas ran you a whopping 31 cents. It was created to provide healthcare insurance to Americans upon reaching the traditional retirement age. Today, Medicare breaks down into 4 pieces: Parts A, B, C, and D. Pretty simple so far, right? Part A is universal for all Medicare-eligible U.S. citizens. This helps to cover your hospital services, hospice care, and some skilled nursing facility costs. This is helpful if, for instance, a coconut falls on your head while you're on vacation in Hawaii, and you wind up in traction. Okay, that might be an extreme example. Anyway, in most cases, Medicare Part A reduces your hospital costs. Part B is also universal for all Medicare-eligible U.S. citizens, and helps cover visits to your physician, outpatient care at hospitals, durable medical equipment, and some preventive services. When you have a stomach ache and see your doctor and he sends you to get an x-ray, that all falls under Medicare Part B. Together, Parts A and B are called Original Medicare. If you have Original Medicare, you may also opt to choose a supplemental insurance plan to pay down some of the costs that Parts A and B don't cover. This is important because Original Medicare also has something called an 80-20 split, where Medicare covers 80% of your costs, but you will be on the hook for the remainder. Meaning, if your medical bill comes to $100, you're responsible for $20. On the other hand, if that coconut from Hawaii puts you in a coma, and your bill runs up to $1 million, well, you get the idea. We'll get to Part C in a second, but first let's take a quick look at Part D. Part D is for prescription drug coverage, and it is purchased from a private insurance company under contract with Medicare, because the government doesn't provide this kind of coverage on their own. If you don't sign up for Part D during your initial enrollment period, or if you don't have creditable coverage for 63 or more days, you may face a 1% penalty for every month you do not have a creditable drug plan. This penalty is not a one-time penalty. In fact, you will most likely have to pay this penalty as long as you have a Medicare prescription drug plan. And because it is based on a yearly calculation, it can even go up year over year. So be aware that not signing up for Part D when you become eligible can cost you a bundle later. Now back to Part C, which is where things start getting really cool. Also called Medicare Advantage, Medicare Part C combines your coverage for doctor visits, certain hospital costs, and other services from Parts A and B into one neat and tidy health plan that has your health needs in mind. Some Medicare Advantage plans also offer extra benefits, like dental and vision coverage, chiropractic and acupunctural care, and much more. And remember Part D? Well, another great thing about Medicare Advantage is that some Part C health plans include Part D at no extra cost, as long as you continue to pay your Part B premium to Medicare. And that, in a nutshell, is the ABCs and D of Medicare. To learn even more about Medicare, including your options for Medicare Advantage, check out www.medicare.gov or call 1-800-MEDICARE, 24 hours a day, 7 days a week.